Hey, hi everyone. I'm here with a good friend of mine, Dr. Luke Afkin, and he's a chiropractor and does functional medicine and also does functional neurology and kind of does a blending of those two things together. I remember meeting him many years ago as a student and actually met his father first, and then I met him, and now he's an extremely successful practitioner and very skilled. And he was even helping me with some teaching events in the past, and just a great guy. So Luke, when we first met, actually we met. I think I met your dad first at a seminar, right? And then tell me if I got this straight.
Yeah.
It was I don't know, Indianapolis, right, or Chicago or somewhere. It wasn't California. It was back east. I
Yep.
met your
Yep.
dad, and then I went to dinner with your dad. I think he took me, and then we a couple of us after the seminar went to dinner, and you showed up. You were there, I think.
Yeah.
And I think
Correct.
that's the first time we met, or did we meet before and I forget it?
Yeah. No. So it was February of 2010. So a little bit.
February, wow, you remember.
Right. So my dad, who's been a chiropractor for some 40 plus years now. At the time, he was about 30 years into practice. He was part of a practice management group, and a lot of the guys within that practice management group would start to come to your courses through Apex Energetics. So, at the time, right around late 2008, 2009 is when my dad first went to one of your courses. I think it was down in Florida. He flew down there, did I think your blood chemistry course. And at the time, I was finishing up chiropractic college, and he called me one day and said, you ever heard of this Karazian guy? Are you familiar with functional medicine? Here I am, just a young kid trying to just get out of chiropractic college, and I hadn't heard of either functional medicine or your name, and so he had gone to that course in late, I think 2009 or so, and he came back from that course just amazed at the amount of material, how well it was put together, and he said to me, he goes, I really feel like this functional medicine piece within the chiropractic profession can be really profound in the next, decade plus and beyond. So my first exposure was to your thyroid course that was in Chicago in February of 2010.
Okay.
Yeah.
And your dad was right, by the way, because functional medicine has been very well. And you're practicing now over 14 years and really pro at this. But when you first started, this field of functional medicine and just doing this nutritional thing, it's not really what you really thought to sign up for, right? Because your dad was a conventional chiropractor, and you were kind of thinking to go that route. And then your dad's kind of encouragement got you into functional medicine. And also, I know you do functional neurology and rehabilitation and those kind of
Sure.
things.
Yep.
And
Yeah, yeah. So leaving school, I thought I was just going to do, the traditional type of chiropractic practice, and things took a completely 180 turn for me pretty quickly. I remember sitting through your thyroid course, just completely feeling like I was drinking through a fire hose, and I was just thrilled that there was a program or teachings in place that kind of gave me a little bit of hope for my future. And I knew right then and there, leaving that course, that was probably going to be the direction I was going to take my career.
you
So
clicked it, you clicked with functional medicine right away. You're like, okay.
it was my thing. I mean, that was my jam. I knew right then and there that that's exactly what I needed to be doing with my professional career.
And what year student were you? Were you in your last year or
So when I came to your course, I was just new into practice. So I'd
just
maybe
new? Well, you just
graduated maybe 6 months before that.
okay. And I
Yeah.
remember one of the times we met, I think it's the first time we met, you had like the course manual. You had so much notes all over it. I'm like, this guy's serious. Like, he's taking so much notes. I'm like, okay, this is the upcoming featured top dog here. So, that's pretty good. So when you finally got out of school, did you end up working with your dad's office first, or did you start your own thing, or what did you do?
Yeah, so I worked with my dad's office with him solely for about a year, and then I moved down to Indianapolis, where I currently am, and I started a practice there. And I still to this day work both clinics. I work with him one day every other week, which is just a joy to work with him and kind of share that professional experience with him. And we have a ball working together, and it's been a fun thing for us.
Yeah, your dad's a class act. I always remember seeing him and again, this guy's a class act. He was always carries himself very well. He's very compassionate. He's very intelligent. Like if you see him, like, okay, I could trust this guy with my health. Or so when you got out of school, you had probably how many hours of functional medicine before, like the first year? You already like jumped right in, you were taking everything. And did you immediately start implementing and practicing right away?
Yeah, I did. I felt like I could go home with, some of the material that you gave to us as students, and I could start to implement that pretty quickly. I knew I needed to fill in the gaps. I mean, there were other courses, there was blood chemistry seminars, and the hormone endocrine piece, and the whole brain course was a whole another layer of things on top of that. But I felt like pretty quickly that I had some systems in place that I felt like I could implement, and I knew that I needed time and I needed experience. You had to put your nose to the grind and see patients. But I felt pretty confident that leaving there that I could do this.
Okay. So you had a lot of confidence because a lot of people, and you ended up teaching those courses all yourself down the road, as you mastered them and were using them. Um, as an educator, and then looking at back, a lot of the difficulties people just don't implement.
Yeah,
They just keep going to a course or they keep hearing something over again, but when they get back in, they don't take any necessary steps to actually do anything. So it's
sure.
like they go through it. This is great. This is wonderful, and you saw that, I'm sure, like I did.
Absolutely.
We all do
Yeah.
as practitioners. What do you think was the difference for you, and what do you think holds people back? Because there's a lot of people who are in the position where they hear it, but they don't implement right away. So what do you think that key difference is?
It's a really good question. I don't know what that key difference would be. I think maybe for me is maybe I was just young and naive and didn't know any better. It might be a little bit difficult, for somebody that's been in practice for a certain period of time to try to change their practice. But I think the big thing that you got to do is just be confident in your skills and just implement it and see patients and try to apply what you know. And really the learning that you're going to get is in the doing, so you have to see patients, you have to implement the material. The confidence will come. You have to start off with some level of certainty and confidence to be able, I think, to help people. But just kind of throwing yourself to the fire, I guess, and getting in there and just doing what you can, knowing what you know, and learn as you go, I think is part of the process.
And looking back, Luke, when did you like, for you, when was it where you felt like I feel comfortable now? What year was it?
It was probably, it might have been 3 or 4 years do I really felt confident to where I knew that I had the material mastered. Um, I remember asking you that same question when we went out to dinner at that thyroid course, and you said, give it 6 months to a year, you'll have it mastered. And I think within that time frame, I was probably close to that point, but obviously new in practice, new learning some material. It might have been a little bit longer than that, but it certainly took a couple of years. And I remember spending a lot of time going over the material, trying to learn it to the point where I just knew that I knew it.
Yeah,
Um, and I think that repetition for me as a learner was critical.
yeah,
I'm sure most people are kind of the same way,
yeah.
where you have to expose yourself to the material over and over again to kind of gain that level of knowledge and clinical confidence that I think it takes to get to that point.
So, I think one of the things that was very unique with you, was you were like, I'm going to learn this material, I'm going to learn the next material, and like you had this one seminar, next seminar, next seminar, all in place, and then you just mastered those fundamentals and you started implementing in practice. And sometimes, as you know, as educator, you see people like kind of they just drift all over the place. They follow like a thought process, and then they like, oh, this is interesting, and then they follow this one, and then at the end of the thing, they don't really have a system, they don't know what's going on, they get exposed to a lot of people, you know. Have you seen that? And what do you think happens in those situations? How do people avoid that?
Yeah, I think I went into my education in the functional medicine world knowing that if I stuck with like your material as an example, that you've already done the legwork. You've already put systems in place, and if I learned your material, your thought process, I had a recipe for success.
Yeah,
Um, and so I didn't want to completely try to reinvent the wheel,
yeah,
knowing that the wheel was already put in place. And as long as I kind of learned the workings of that type of process, that things, good things could potentially happen for me in the functional medicine aspect.
yeah. And
So I think I kind of went in with that mindset that as long as I followed your roadmap and your game plan, that I had a pretty good stout process in place.
Yeah, the game plan. That's what I did too. So for me, when I was in school, I got exposed to two people that really had a big influence on me. One was Walter Schmidt, the guy named Wally Schmidt, and Jeff Bland. And I remember as a student, I got exposed to them like my third trimester, and I still was just getting over medical terminology and basic physiology. So I didn't really understand it. All I knew is this makes a lot of sense, even though I don't understand all the so I spent half the time looking up the medical terms and doing stuff and trying to figure out what they were saying. And for me, it was the thought process that was more important than anything. Like I just want to know how they think. So what I remember doing is going and finding everything in the library and then chronologically reading it in order to see, like Jeff Land had, I think at that time had like a dozen or health books in order. And I was just like, okay. I'm starting to understand the thought process because there's always information. Like we can Google everything, but the thought process is really where I think you develop a skill. And then eventually you kind of fine tune it and make your own thought process and have your own priorities. But I think that's the biggest difference where people waste their time. They just think if they know more information or more protocols, that's going to be more effective. But it's really once you start to really think of a critical way to think and a critical priority list, and then you start to implement and you start to look at objective numbers, then you start to develop that thought process. And I think with functional medicine and we do laboratory tests like we all do, you get to see objective change and subjective change. So even if you have a bias, then may not play out. You're like numbers are
Right.
changing.
Right.
I think you should do
Yeah.
that.
Like I was saying, I mean, you realize that when you do some type of diagnostic, some blood work or some type of information like that, you're gonna open up a door, which is the material that you're gonna gain, right? And so with that material, you might be then presented with a couple other options and different routes that you may need to go. So you might have to make a choice. By opening up that door, you might have to go to the door one or door two to investigate what you found with what your prior information gave you.
Yeah.
And as long as you, I think, kind of knew what to expect as opened up those doors, it gave me rather kind of a little bit more of a clinical confidence that I can you know go through work up a patient, kind of knowing what to expect and what my next process and what my next step may be. So I didn't want to get into the world of functional medicine and have a whole bunch of surprises. I needed, I think, from my standpoint, kind of what that thought process was. If I work on process A, we need to then go to B to C to D and kind of move along the line. So I think that was kind of helpful, knowing kind of what that thought process would probably look like for me.
Yeah. There's some guy, Andrew, Andrew, my wife, yeah, Andrew very well. Yeah. So she was like, hey, I saw this guy on Facebook. And he was like, I've been doing functional medicine for X amount of years. I have all the protocols. Let me give it to you. And I remember, and then someone posted, if you need all these protocols, do you know what you're doing? Maybe you should stop talking. And I was like, that's so funny. It's like, that's so true. Because it's really the critical thinking and the thought process. And then seeing if objective things change that really make the difference. And I could, like, for me as a person watching other practitioners develop, and you were on the road just like I was teaching, and you get to for many years, and you get to see people over time develop and grow, and you can see lots of things happen. But the ones I saw develop, and tell me what your thoughts are on it, were the ones that were really doing repeat testing. They were just checking things, at a regular rate to see if things are changing, whether it was a adrenal profile or blood panel. And I remember recently I just did an interview with someone and like, yeah, I don't retest. I think it's fine. And I'm like, wow, you're never going to like get to the next level.
Sure.
And what do you think about that? What are your impressions as an educator, as a practitioner, retesting? How do you retest? Like, what things worked for you? How are you doing it?
Yeah, so I think retesting is really important. I think part of maybe it's hard for me to speak for others, but people may not retest because they don't want to know if
Exactly.
what they're doing isn't working, right? There's nothing more clinically depressing than maybe redoing a diagnostic and not seeing any type of change, right? So I think you have to go into this knowing that that is the possibility that if you were to do some retesting, that things may not change, and that's fine. That tells you that what you were doing wasn't it, right? And so I think retesting is critical. I don't know if you're looking for, you're curious about the frequency at which I retest or what that looks like in my office.
Oh, I'm sure for every test, there's different frequencies depending on the patient, but
Sure.
it's one of the things like I've noticed talking to other people, and I trust your opinion on on the same topics and just get your feedback because I know you practice and you also teach, So it's like I was doing the interview and this person, like I was like, I don't retest. And then I think it's that fear of not wanting to know if something worked. And for me, whenever I retest and things got worse, it was like, okay, well that tells us something, And I think people are so afraid of that they never get to see if things grow. Then they get stuck in their own little biases, and then they start blaming other things. They never go deep enough, you know.
Mhm.
And for me, I get your feedback if you have the same experiences. Like for me, when I totally fail and like nothing has worked or things have gotten worse, it's actually when I have the biggest clinical growths in my career. You know, whether I retain the patient or not is a different story.
Sure.
Because then the guy like, I just grinds at you. What happened? What did you feel? What did you not do? Or what was going on? Do you have experiences like that, or how do those things work for you?
Yeah, I mean, I think, failure is something that we're all going to experience probably in practice, right? And so we have to just learn that, as we undergo those maybe failures, quote unquote, in practice, that those have to become learning experiences for us. And so, as we learn what those failures are, I think changing, maybe a little way that we practice and those things are critical and not only to help future patients, but, for our future practice and kind of helps us grow as clinicians and so forth. So, yeah.
I don't know about after this, you do the same thing, but I have like two patients. I know their first name, I know their last name, I've never forgotten them. And I wish I could find them because now I know what I could probably should have done with them. But like I saw them maybe like my third year out of school or something like that. And I don't know why I was so emotional at the time, but I think it was because, oh, this is my practice. I got to build it. I want to be really good. And these two, I just completely bombed. And they were like the most forgiving patients and just like supportive. Well, you'll get it. You'll figure it out. Just keep going. Sometimes patients are like, just try. Like, I don't have anyone to try. As long as you're trying, I'm happy. And then you get frustrated. And it's like the ones that remember. And I can tell you as an educator, I could immediately tell the difference between practitioners. The ones that always remember their clinical successes were the worst practitioners.
Hmm.
And the ones that, and then the one to tell you about it. And
Right.
like, and then the ones that just were tormented because they couldn't figure out what to do were always the best practitioners. So the one that's trying to tell you what they did to the case and what you're teaching is actually not right and that you should do this, you're like, oh gosh.
Yeah.
Versus the ones like, hey, I've tried everything. You have anything that can give me some insight that makes a difference. What was your experience when you were teaching on the road with different personality characteristics of, healthcare professionals and what you saw them as being successful? And as an example, that was one thing I saw. Anything you noticed?
I think one thing I learned pretty early on from you was that you have to temper our expectations and realize that autoimmunities, uh, having a practice full of autoimmune patients and people with complex metabolic issues is completely different than having maybe like a musculoskeletal practice where you're going to maybe expect quick results and quick success. Obviously, with some of those patients with autoimmunity in a metabolic practice, you're going to have some of those quick successes, but tempering your expectations so that you can, I think, transfer that on to the patient, I think is also really important too. So I think that was a really important thing that I heard from your material earlier on so that I could set myself up for, I guess, success, right? Because if you go into every single scenario and you just expect that you're going to get somebody better within a short period of time frame, might be a little bit more difficult on your psyche, and it kind of just becomes a little bit more difficult for you as a clinician to feel confident in those skills. So yeah, I mean, I wouldn't say there was anything specifically on the road that I have an example similar to that one, but I think that was something that I took away from you early on that was, I think, helpful for me.
Yeah. So, you know, like right now I'm doing this clinical master program and we're following cases along. Some of the comments I've gotten back from friends of mine that are honest with me about the cases, not like people that are nice, that like, your true friends that just tell you everything. They're like, hey, you suck. You haven't seen the patient for like 4 months. You haven't done anything. I'm like, you gotta wait. Yeah, like I don't know what the capacity response. I'm not the only variable of
Right.
whether they get better or not. And then now that we track some people like 8 months, a year, we're seeing some big changes in some of these patients that never had any recovery for the past 10, 20 years, it's that endurance game. So I would guess your practice is pretty much complex cases, severe autoimmune diseases, and neurological cases and things like that, correct?
Correct. Yep.
So with that patient population, how do you how do you talk to them about the expectations? What do you think have been what things have been you know what would have been good ways for you to have success translating that message with them and
I,
getting
I think I always like to go into a scenario asking them personally, what do you define as success,
mm,
right? So I always want to know, kind of going in, if there were multiple things, one, two, three, four things that I could help you with, what are they,
mm,
and what do you term as success within a certain time frame?
right.
I think as long as I can kind of understand where they're at, I mean, if they're already setting the bar too high, we already know that we might fail and we're going to be a disappointment to them. So if I can kind of know and get a good gauge and understanding where their expectations are,
Yeah,
where I can take them, because we want to go into these situations both on the same page.
yeah,
So knowing what they expect from me allows me to even let them know right off the get go if I'm going to be able to help them get that there, or if we need to kind of change our expectations, and it's all kind of guided a little bit based off of what they term as success and what they want help with, and if I feel that I can get them there within that time frame.
yeah. That's one of the steps I think you were pointing out. It's so critical because like if your expectations are different than the patient's, you immediately have possibility for the case to fail and the
Yeah.
patient has. Um, and I don't know how you're doing it, but I like to like put clinical goals and then we make the clinical goals things that we both think is realistic. Like I have a recent patient, the clinical goal is to drink 8 ounces of water without getting severely bloated. And it's like, okay, that's our goal. Like
Yeah.
that's all we're trying to do. We're not trying to get you to be how you felt 20, 10 years ago. That's step one. That might take us a few months to do that. And then once that mindset is there, that makes a big difference. Do you write down patient goals with them? Do you go over after each session? What kind of things are you doing? Just in
So right off the beginning, I kind of get an understanding of what those goals look like for them. And so I, get some stuff in writing so that I know that kind of what those goals look like. Um, and so we'll retouch base, usually, once a month, once every 6 weeks with patients.
okay.
And so I kind of have, that material to know and kind of be my judgment, my gauge on, whether or not we're kind of reaching those goals and if we're having the outcome that we both were wanting to have within that time frame.
Okay. So let's say I come into your office as a new patient and I have like migraines and sleep issues and fatigue and mood changes and things like the whole list of things, right? Like a complex kind of case with no real medical diagnosis of anything that is clear, right? Just that functional gray area patient.
Mm-hmm.
I've been suffering for this for like 10, 20 years. What would be the typical like workup and follow-ups you would do? Do you do like a regular follow-up every time? You do a workup? Do you do a report of findings? How are you like how is a person like that walking into your office setting and going through the process?
Yeah, so the process in my office, what we'll typically do is, we'll have them fill out paperwork ahead of time, so I kind of know going into that first interaction with them, kind of what they have going on. They're going to complete all of our paperwork and assessment forms, um, and with that first interaction, we're going to be able to come up with our game plan depending on what type of diagnostics we're going to want to see. Are they going to do some blood work, some saliva testing, some stool assessments, food sensitivities, whatever it may be. And so then we'll send them out for that diagnostic, after that first visits in most cases. And then I'll come back, once we get that material back, then we'll sit down and go over that material. And from that type of workup, what we're able to do is, give them a good guidance on diet, lifestyle, nutritional supplements, and some things from that sort to kind of help influence whatever those goals and objectives were.
So look, how long is your first report of findings session?
So I usually take about a good hour to an hour and a half going over whatever diagnostics we may have.
Do you base that before the appointment, or some people like book an hour and they end up going an hour and a half. I'm like, oh well. Or do you like, oh, this is a lot of stuff to go over. Let's make sure to do an hour and a half. How are you doing it?
Yeah. So the first appointment, is that what you're referring to with
First,
patients?
like once all the labs come in and you're gonna sit
Once the
down.
labs come in, once we get all that back, hour to an hour and a half is about the amount of time that we'll kind of put on my schedule to go over all that stuff with
You
them.
decide that ahead of time.
Yeah, we kind of know, depending on how much material we have, how much time it's going to take to go over that stuff.
Okay. What do you do when you have a patient that's a topper? Like you're not gonna get through it. You're looking at your watch. You're going, okay,
Yeah,
I've got like 6 more reports to do.
yeah,
And we're like 15 minutes. How are you handling those situations?
yeah. Those are really tough. I think what I try to do is let them talk a little bit to begin with, to not feel like I'm shutting them down, because the minute they feel shut down, I think, I don't know what your practice is like. But I think a lot of patients come in and they just want to be heard,
Mhm.
right? They like a clinician that is just going to sit and listen to them, to all of their complaints. But we don't want that to go on too long, because sometimes it can, like you said, put you behind, and before you know it, the hour to an hour and a half that you budgeted for, an interaction with them, we don't want that to bleed over too long and push everybody else behind and upset everybody towards the later end of your day.
Right.
So I don't know exactly how I go about those things. I think I just reflexively just practice. And I think I just kind of, in a way, just bring it back to everything that we're working on, the information that we're needing to cover, whatever diagnostics we're going over. And I try to bring them back in. I think that maybe some of those patients are pretty brain foggy.
Mm.
They feel really distracted. And,
Yeah.
sometimes they just have poor mental endurance. They just can't do 60 or 90 minutes straight of interaction. Sometimes it's maybe a little bit too much clinical information for them, possibly. So, maybe taking a couple little minute break of just kind of letting them go on a tangent. But we don't want them to go on too long, because it, can certainly affect everybody else later on in the day in the schedule. So I think, Datis, what I do is I just kind of, in a way, talk over them, and I rein them back in, and I kind of bring them back to down to earth. And I try to be the director of the time that they're there at my office, but not be so direct and rude with them that they feel like I'm just treating them like another number. Does that make sense?
Yeah. Yeah. I mean, I think sometimes I'll say stuff like, I don't, I respect your time and I want you to understand everything, but I have all these patients after you. How do you think we can use the last 15, 20 minutes? That's best. That seemed to work for me. There's a guy like Mike Stone. I don't know if you Mike Stone. He's like, I really want to get this information to you. Maybe we should book another appointment for another hour to go over this to really make sure you feel comfortable with it. We only got through this much and we still need to get through this. And I'm all, okay, that works too. But those are like situations we're all faced with. Like it's hard to do. It's hard to deal with it. And hopefully you're not having a bad day, and then you're like snapping, and then you get frustrated because it can ruin your vibe and energy for all your other patients. Right?
Absolutely.
Get through it.
Yeah.
And then
Yeah.
there's,
That's
there's a guy.
tough.
There's a guy. I won't mention his name. He's a practitioner. He used to put a red sticker on his files when they were. He called those people like vampires. They just suck everything out of him. They couldn't get anything done. That's when there was actually back when there were still files. There was a red sticker on it. They're like end of day patient, no exceptions,
Yeah.
and only one per day. That's
Yeah. The problem is you do it too late in the day, and then it bleeds over into dinner
dinner,
hour.
dinner.
Get
Yeah,
home late, and the wife's asking where you're at, and so
yeah. I mean, everyone's got to have their system, right? So, with your experience over the years, do you think you've gone into more testing or less testing with your patients, like as far as diagnostic testing, or is it patient to patient based? Of course, some of that is patient based, but are you, you know, do you want to see more of the big picture in the beginning? Do you want to see less? Let's say the patient is neutral. They're not. Sometimes patients come in and they go, just test everything. I just want to know. If
yeah.
the patient's on a budget, but if they're neutral and budget is an issue, what do you typically do?
I I think the longer I've been in practice, I think I might do a little bit less and less testing overall.
Right.
Um, and I don't know if that's just me, or if that's just what I've gotten into. I tend to be more of a minimalist, meaning I feel like when I first got into the functional medicine practice, I felt like I needed to have all the material to know what to do.
Mm.
And like I tell patients, the more I've practiced, I've got a little bit more of like a gut sense for things, based off of our interaction, our communication, and the way that we communicate, or the way that we, have talks with patients. So I think just doing a good comprehensive background, um, and looking at their history, I think gives us a lot of good information.
Yeah.
And so what I'll do is after that, I have that interaction with patients, I say, listen, based off of all the things that we've discussed over the last time period, here are some potential tests that we can do to look at everything that we've discussed, right? We could do, blood work, we could do saliva testing, we could look at hormones, we could look at this. I don't know if I need to see all of it. You as the patient, what do you need to see? Because sometimes, I feel like I deal with patients that are very left-brained, are very linear, and they need to see the testing information to confirm in their mind that they may have X, Y, or Z going on, right? Um, so I think as time has gone on, I've done maybe a little bit less testing,
Yeah.
but we don't want to do so little testing that we don't get the answers that we're looking for, though, too. So I think it's kind of that fine line of doing enough testing to get the information that we need, but not doing everything to make it look like we're doing an impressive workup. Like you
Right.
said, I mean, sometimes you have patients come in and they have no financial barriers and they just want to test everything, and that's great. But sometimes I think if you're new into the functional medicine practice, you can get a little bit of what we call paralysis by analysis, right? So if you get too much to analyze, you get overwhelmed with the information, either you as the clinician or the patient.
Yeah.
And if you get paralyzed by the amount of information, then that can be a little bit difficult if you get too much stuff to review.
Yeah. Yeah, for sure. I think that's a trend I see as well, even for myself as I got more and more experience. I don't want to see everything. Every now and then you get a patient wants everything tested. You're like, oh well, this will be fun. Let's do this. This will be fun. Like starting all these exotic panels you don't want to do, and they're like, yeah, let's do it. I'd love to see that too. And I'm like, okay. And then other people that maybe are going the wrong way, and you just go, listen, all I care about in the next month is you stabilize your blood sugar and sleep. Like nothing else matters. The only thing we want to change the next month is that. Then we can do some testing. But right now, you gotta like eat some meat or not eat some protein or like
Yeah.
more
Just
frequently.
or
And
just eat. Yeah, sometimes just people just, hey, you need to wake up and just eat breakfast, right? For some people, that just completely changes the rest of their day. Those patients that might be hypoglycemic and
yeah,
have issues with just even sensing hunger in the morning, having them consume some food to begin their day, obviously
yeah,
breaking their fast, right, with breakfast,
yeah,
can be a game changer for them. So, yeah.
yeah.
So that
So
might be the person if you get too much information, they just get overwhelmed with all of the stuff that they leave your office with, and then the compliance can go down, and then you don't get anywhere after a couple months, and they're scratching their head trying to figure out why they didn't get anywhere when it might be something simple like, hey, eat breakfast and get some sleep and lower your stress levels. So
yeah, and then also the other concern that question that always comes up is when there's everything wrong. Like they have a blood sugar issue, they have a prostaglandin issue, they have a gut infection, they have leaky gut, they have blood-brain barrier permeability, they have multiple food sensitivities, they have chemical overload. Where do you start?
yeah, that's a really good question.
I'm giving you the hard ones.
Yeah. So no, I think typically where I would start with, that type of scenario might be something like if we can down regulate the inflammatory process, we can stabilize blood sugar, and start to, that person might have all these food sensitivities. Like, hey, let's change your diet, let's stabilize your gut, and let's lower the inflammatory load. We can sit back and see what happens, right? Because sometimes if we're working on one issue, like let's say, inflammation in the gut, sometimes the adrenals might fix themselves and we don't have to go in there and do specific nutritional application for that. So I guess we kind of never know how to unravel these things until we get in there and start working on things.
Yeah,
Um, but I would say most of my patients, blood sugar stabilization, inflammation, working on the gut are a lot of times the beginning stages that we start with most people.
right. And that's another key thing is the concept of working through a case, right? Like you said to the patient, like we'll see what shows up. We'll see what happens. Like, get some of the smoke screen and see what happens. That's a normal process. And I think people that are learning functional medicine, as you know, you were teaching a lot of people also, was like they get so nervous and scared not knowing where to start. And it's like, we don't know where to, like, just start pulling on the web
Right.
and start to see where things start moving and then address those things. And
And that's where that mindset of not going into these things with a protocol mindset,
yep,
a little bit, I think, freeing for the clinician, right?
yep,
I think protocols are nice to have for the clinician. They're not that great for the patient.
yep,
The protocol is good to for you as a clinician to feel confident that you're doing the right thing. But if you get too many protocols, so to speak, in place, and you're overwhelming the patient with too much to do,
yeah.
then the compliance can go down, and the effectiveness of your care can also be compromised. I think because of the amount of stuff that you're trying to do and achieve all within a short time period of window. So
Luke, how often are you doing follow-ups? So you see a new patient, you work them up, you got to put it, you get the labs back, you've thought through like a place to start, you talk to them. Then how often are you doing follow-ups? And has that frequency of follow-ups and the time between each session changed over the years?
yeah, so typically what I'm going to do is a follow up. Let's say I work with a patient from a functional medicine standpoint. After 4 weeks, I like to have them come back in and we'll just have a conversation, see what type of outcomes we're having. Are we achieving their goals? Are they progressing at the right pace off of what we were anticipating going into this?
So two
Uh,
weeks is your first follow-up?
yeah, so my first follow up visit's after 4 weeks.
Is after 4 weeks? Okay.
I'll do another one in most cases, right? Sometimes we need to be a little bit more aggressive with that follow up frequency, but usually after 4 weeks, I'm going to do that first follow up with the patient. I'm going to do another one again after another 4 weeks.
So every
And
month, kind of doing it. The
so,
first,
yeah, so at month one, we do a follow up. At month two, we do a follow up. And at that third month, they're going to redo some diagnostics for us, let's say maybe some blood work or whatever. And so that third interaction with them from a follow-up standpoint, we're going to relook at some diagnostics and see if the subjective change is also matching the objective change as well, right? Because like we know, I mean, redoing that follow-up blood work or whatever it is allows us to understand, are we having the right type of change physiologically? We want to change those things and we want to see those markers move. And if they don't, we just know that we've got to maybe dig a little bit deeper. Maybe we underestimated, certain topics. We might need to go back and at that point, do some food sensitivity testing or look at, the gut through a stool assessment and so forth. So, usually after that, third type of follow up, after we've redone some diagnostics, I might push it out to maybe another 2 to 3 months before I interact with them again, as long as we feel like they're at a good spot, they've progressed at the right pace, their health goals are being met. And if things are, at a good spot at that standpoint, we'll start to maybe space it out to maybe every quarter and see them. And then usually more of like a maintenance metabolic patient, I might redo some blood work or some diagnostics every 6 months. 6 to 9 months is kind of a good time frame for us to recheck some of that stuff and kind of make sure it keeps them compliant. It keeps them kind of in that mode of kind of the direction that we've gone. We want to maintain the progress and the momentum that we've made over that certain time period.
and how long are your follow-up appointments?
Follow-up appointments were usually about 30 minutes or so.
30 minutes. Okay. And do you charge by time or do you charge by what do you find works best for you?
Yeah, so I kind of created a certain amount of, I guess, income I want to make. I mean, how valuable is my time, right? And so I kind of came up with how much I want to make per hour, and I try to charge for that accordingly.
Has that
Um,
changed over the years?
I'm sorry.
Has that changed over the years?
Yeah, it has. It has. It's gone up. I think when I started off, when I look back at some of the fees that I charged when I first got in practice, I mean, I gave my service away.
Yeah.
One of those things my dad, was always hounding on me. Hey, Luke, you don't charge enough. And he still maybe tells me to this day, you don't charge enough. But I think for me, first in practice, I knew that I needed to gain experience. And so for me, gaining experience, I think was charging a fee that nobody wouldn't want to pay, right? And so I didn't make a huge income to begin with, but I gained a huge amount of, I think, knowledge and experience by just seeing everybody and just getting my hands on blood work and talking with people and so forth. So that's changed over the years. So I try to charge, how much do I want to make per hour? And then I kind of can gauge my fees based off of that hourly income that I want to make based off of the service and so forth.
You have the cancellation fee?
I don't.
How often do people cancel on you?
Um, I would probably say maybe 10% of my 5% of my appointments are cancels
Hmm.
or rescheduled. So yeah, I mean they happen. I know some offices charge cancellation fees, but
Yeah, I mean, it
uh,
depends on your area and
that's
your
just not something that I've done. I probably should, but
or patient specific cancellation fee, like a
yeah.
policy would be like so. Okay, and um, how many days a week do you practice now?
So I practice 3.5 days a week. So I'm in the office, like I said, 3 days a week here in Indy, and then every other Wednesday I'm up at my dad's clinic.
Which is really more of a social thing, but right, I mean, you get to interact with your dad, and
It's great. Yeah. I mean, we love just practicing together and interacting with each other and kind of, I don't know how many sons get the ability to practice with their father and kind of experience that. So we cherish it. And, he's 43 years deep in the profession and still going.
wow,
So yeah, he works 4 days a week. Yeah.
fully-
But
so
I started taking Fridays off. I think a 3 day weekend, for
sure.
me personally was outstanding.
Yeah,
It allowed me to feel like I got into the weekend, I could recharge, get refreshed, and then hit it strong, hitting again Monday.
that's good.
So
You,
yeah, I'm already kind of part time, I guess. So I don't know if that's good or bad,
I
but
don't know if that's part
that's
time. I
where I'm
think
at.
most
So I
practitioners.
I, I want to pace myself. I'm going to be like my dad. I'm going to be the guy that's 75 years old, still in practice. I think the beautiful thing about functional medicine practice is that as long as you maintain your brain and your health,
Yeah,
you can do this work until you're 80, 85, as long as you want, right? So you can work, you know, part time. You can work full time. You can do it remotely. You can do it in an office setting. I think the what I liked about the functional medicine stuff is that you're flexible,
yeah,
right? You don't have to be hands on with every single patient,
right.
right?
It's a pain you have to get someone out of or something like that.
Right, and you can do it from your home office. You can, have a facility that people come to you. That people can work from near, they can work from far. The ability to access patients from all over the country is limitless. So that's definitely been one of the perks, having a functional medicine type of practice.
What's the longest you've gone without practicing? Like
A week,
vacations? 1 week.
1 week. I went on a week vacation a couple weeks ago, and I was ready to get back to practice.
Okay, so you missed it.
So my wife, she had to. What's that?
You missed it. You missed.
Yeah, I did. I did. Yeah, I like working with people. I like interacting with people. I like to be in a position where I can help people. And so, taking a week off was great, but it was good to recharge and get refreshed. But that week was over, and it was time to get back to work. So,
Yeah, that's really good. For me, like over my career, I haven't been able to work like your dad 4 days a week. So now I do like uh 3 days every other week.
mhm.
Now I need like a week or 10 days to recover and recharge, and then the same thing, and I can't handle more than 4 new patients ever a month. And after that, it's like too exhausting for me, and you know, over time, but everyone's different. Like I think everyone, some people need to be in practice more, and it charges them. For other people, they need some more of a break. And
Mhm.
then I remember going, okay, I really can't do this as much. Um, And then I was like, okay, well, what's the option? I have to raise my fees so that I can do less. Am I still going to have people wanting to see me at that point or not? Or but if you're like missing it, that's totally different.
And I feel like I get in a clinical groove when I'm doing it week after week after week, right? When I take some time off, I feel like sometimes it's like walking through mud again, trying to like get my sea legs back, back into practice. So that's kind of one thing I noticed. If I take too much time off, I feel like I'm just not as efficient
Mhm.
for whatever reason. I'm sure it's probably just the way that I feel.
Yeah,
I just kind of like the I don't know what type of word I'm looking for, but the consistency that I see, in practice, with my schedule. And, like I said, I'm in it for the endurance. It's not a rat race for me. I want to take my time. I want to work with patients. I want to be doing it for a long period of time. So I think the functional medicine practice kind of affords me that ability to kind of go the endurance route. So
Right. So when you see someone new going out of school, whatever school it is, medical school, chiropractic school, naturopathic school, and they have an interest in functional medicine, what would you say to them?
I would tell them they're in the right field.
You tell them they're in the right field. Okay.
Yeah, I think so. I mean, I think well, I think what I like about functional medicine is that it doesn't discriminate versus Western medicine versus chiropractic profession or anything you know Western or natural. I think we are all trying to achieve the same goal. We're just looking at it from different perspectives. And so I think that as long as they enjoy the functional medicine mindset and type of practice, that they're gonna succeed in that type of world, because I don't think that we're ever going to run out of patients.
Yeah.
And so I think that the patient population is pretty unlimited when we're looking at things from a functional standpoint, right? What I like about functional medicine is it's not all linear. It's not just hyper focused on one type of topic.
Yeah.
We don't want to be specialist in one thing. I think that's one thing I learned from you to begin was you don't want to be the specialist in anything, right? You want to be a generalist in all topics, right?
Yeah.
And what I loved about I think your Apex material when I took it, 12, 14 years ago, is that it blended the neurological piece, the metabolic piece, the endocrine piece, the immunological piece, and it allowed each individual topic to kind of interweave with one another, and the material became 3D, started to pop off the page for me, I think, because we were able to make connections, with how the hormone system influenced the immune system, which affected nervous system, which affected endocrine responses, and just kind of I could see how the wheels would turn.
Yeah.
That was, I think, extremely helpful for me right off the get go. So
I think that's the biggest challenge when people first learn functional medicine is just the background physiology of interconnectedness. They all work together, and then your next clinical skill, like once you see that, you're like, okay, now I can see the big picture. They may have this endocrine issue, but I have to start with the immune system first, or or whatever the scenario may be, and then knowing how to prioritize, and then it just comes with experience, and that's okay. And then just feeling uncomfortable, like, do you feel comfortable every day seeing patients?
I feel comfortable seeing them. Do I learn from them all the time? Absolutely,
Okay.
which creates a little bit level of uncomfortableness. I mean, there's still things that come in my office every day that challenge me.
Yeah.
And I've got patients that come in and I'm like, hey, listen, I don't even know if I can help you. You're not getting a medical diagnosis. I don't know what you have. I don't know what's going on, but I'm going to try. And as
Right.
long as we take a little bit different perspective and learn from the past of what hasn't worked, and if we know if we do things the same way over and over again, we're probably going to get the same result, right? So, um, you know, those types of patients afford me the ability to think outside the box, try something different, try something new, and it helps me kind of learn from their cases and unique situations in some cases.
Yeah, I still feel every time I see a new patient, like, what am I supposed to do? And then I always feel that way in the morning. And I get there, and I do a workup, and I finally get through it, and then I always think, okay, maybe there's something we can do. There's always that level of
Yeah, and that's what I
that's
like
okay.
about it. I think for me, like when I was leaving chiropractic college, it was I would see the same patient over and over again, and I would do the same thing, and I felt almost a little bit too much of like almost like it was like just the repetition for me was just boring,
Right,
right? And so what I loved about functional medicine is that people would come in with similar complaints and issues, but each individual person had their own flavor of what each blend would be, right?
right.
So a lot of times people come in with stress, tummy issues, fatigue, inflammation, but what's the root cause of all of those, right? And for everybody, it's a little bit different, and that's what I kind of like about it is that there's similarities, there's things that are um, similar in some cases, but they could be completely different from at the same sense. So
Do you,
makes it
yeah, go ahead.
it makes it fun. Yeah,
Yeah.
enjoy it.
Do you, do you ever call it quits with the patient, assuming that
Have
they're willing and they're
I
still,
ever called quits with a patient?
yeah,
Yeah,
like not because of personal issues or
just
like
because.
professionalism.
Yeah, I mean, sometimes you're gonna do some things with patients that just don't work out, and you both realize that, hey, we've given it an effort. The patient's done everything I've asked them to do. I've exhausted everything that I know how to, and I kind of give them an option. And hey, listen, I don't know where else to go with what you have going on. If you want to stick and learn and grow with me, I'll we can do that. But that doesn't happen very often. But yeah, I mean, I think having those conversations have occurred a couple times in practice.
Yeah, I've had I have those too. And then when they happen, I'm like, I think we should. They're like, the experience is like, no, are you kidding me? I can't go anywhere else. I can't do anything. And you're like, you forget like how valuable you may have been in their case.
Sure.
Because what you're hearing is the problem each time, but you've actually helped them along the way so much. And then I think the times it doesn't work is when they're really expecting something unrealistic. I mean, there's people, as we all know, that have uncurable conditions and they want to be cured of something that's not curable, right? Someone has traumatic brain injury, they have permanent injury to the brain, someone has an autoimmune disease, it's progressing over time, people are just aging rapidly and those tissues are gone and they want to not to feel the way they do, but there's some permanency in some conditions
Yeah.
and that expectation there. So I always end these interviews, Luke, with asking the doctor we're interviewing, what advice would you give to new people that are going through the functional medicine program? Like the graduates that go through our programs, and then what advice would you give to people that are advanced? So, whichever one.
So for those people that are, I think the easiest one to answer would be the because the person that's advanced is I don't know how to answer that question. What I would tell the person that's new in the functional medicine world is that just realize that as you learn and grow with the material, that you're going to have days where you feel really confident and you feel really smart. And there's some days where you're going to feel really dumb and you don't feel like you know anything. Um, just stick with it. For me, I think repetition is what helped me the most. So I remember, taking your manuals and just reading them from cover to cover multiple times, engrossing myself in the material was helpful. So I think just sticking with it. If you've come this far, just know that you can get there. It's just sometimes takes a little bit of persistence, and but you'll eventually get there.
Yeah,
It might be a year for some people. It might be 3 years. But I think to recap, like what we talked about, you have to apply yourself.
yeah.
You have to be in the trenches. You have to get your hands dirty, and that's the best thing for you.
And for advanced, you're tapping out. Come on.
I don't know. I don't know what type of advice. I don't even know what type of advice I'd give myself if I consider myself advanced. But
Yeah,
I think the advanced person is that just because you think you have it all mastered, um, we know so little about everything, and I think that the world of functional medicine and our understanding of the body is changing every year.
yeah,
I think that's one thing I've appreciated about your material is that you're always implementing new stuff,
yeah,
right? Your programs through the Krasian Institute, through Apex Energetics, it was always evolving and changing. There were new things that you learned,
yeah,
and I think with your growth came my growth. So I was definitely appreciative of having access to your material and just knowing that whatever I was learning with your content wasn't stagnant.
right.
So whenever I felt like I had it mastered, you would kind of come out with something new and different. Would make me realize that I've got something new to learn, and that I think was encouraging
Yeah,
because I didn't ever feel like things were stationary
yeah,
in my learning process. So there's always room for growth, and I think that's the beautiful thing
yeah,
about that person that kind of has it mastered already is that the sky is kind of the limit with
yeah.
what you can learn. So
And I think things become more fun the more you more advanced you become as a practitioner over time. You're never going to feel comfortable, but you're going to learn more.
Yeah, I mean, you always get to hone your craft. I mean, you can always change some things up and, implement some new material, and it's not the same thing day in and day out. So to me, it's not a boring way to practice.
I see some people that like go, okay, I want to do functional medicine. I'm committed. I've been doing this for 5 years. And you're like, okay, so how many years are you going to practice? Oh, at least the next 30 years. Okay, great. Do you know all the cardiovascular markers and functional? No. Do you know all the autoimmune ones? Okay, well, like if you know it now, then you have it for the next 30 years that you can use. If you keep waiting to learn it, think of all the time you've lost. Like just start like focusing and get each of these things down. Because then you have the rest of your career to implement them. So whatever you master now will serve you for the rest of your career. So why wait 5 years to learn it? Just like focus, But everyone is going at their own pace.
Yeah. Sometimes you just got to jump in and do it. And that's the beauty in it.
Okay, Luke, it was good to talk to you. Thank you for sharing your wisdom with us and your experience.
Thanks for having me. I enjoyed it.
Thanks.